Hi, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links. Proceeds from purchases help to support our show. Thanks for listening.
We hope you enjoy the show. Welcome to PetAbility. I'm your host, Kathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives. Good morning, Chris. How are you today?
Hi, Kathy. How are you?
I'm doing really good today because I woke up this morning. I turned on the television to the Today Show, which I love, and they had an episode about the Houston Zoo doing yoga with their elephants as part of their daily routine. And it was so cool because they were doing a lot of the same things that you and I do with our patients. They were doing leg lifts and alternating leg lifts and, the play bow or the downward dog. And they really seemed to be engaged in it. And it was a wonderful sort of way to get them to stretch and warm up for the day, but also a little bit of like mental expenditure. So it was really kind of cool to see. So it's a part of their daily routine. Every day, 5 minutes of elephant yoga.
So I have a question. If an elephant is doing downward dog, is it called the downward elephant?
I think it's probably a downward elephant. I would guess. I would say so. So. But also it gives these trainers an opportunity to see how the elephants are doing physically, right?
Right.
Can they do the exercise? Can they lift that leg? Can they do the alternating leg lift? So It was pretty neat to see. Yeah, it was pretty neat to see. Yeah.
Yeah. Does it look the same as it did last week or yesterday? Are they having troubles? And I love, like you said, the mental stimulation, because we know that elephants are so smart. And, without being too disparaging, I'm sure in a zoo type environment, there just isn't as much stimulation as there would be if they were out in nature. And so this is a great way to, teach them things in a positive way and get those brain circuits going. When I had Flow Dog years ago, I actually started a yoga class with a trainer that did yoga with dogs. So I brought in the pets, the dogs, and their people, and we taught them how to train their dogs to do various poses. And, it was all inspired because I saw this book, and it was kind of a jokey book where the pictures were Photoshopped. But I'm like, no, like you said, Kathy, we do a lot of these things in physical therapy. And how great would this be to be able to teach them and their owners, bonding experience, promoting health, enrichment, all of that. And the people loved it, and it gave them new tricks, if you will, in a healthy way to do with their dogs, their furry children.
It sounds like a lot of fun, actually. It sounds like a lot of fun. I'm not sure I could get Mac to do anything.
I'd be surprised.
But anyway, we have a great topic today and a great guest, Chris. And we have been discussing having a show on elbow dysplasia for a long time now. And this is something we see quite often in rehabilitation. It's fairly common for us to see dogs with elbow dysplasia in our practices. But it kind of started making me think about the elbow joint and its complexity and its structure, because the elbow joint, as we know, is made up of three bones: the radius, which would be our forearm, and the ulna, which is the bone right underneath that, and the humerus, which is just above the elbow in the human. So that's above the elbow joint. And if those bones don't fit together perfectly due to growth or abnormalities, you're going to end up with abnormal weight distribution on areas of the joint that's going to cause pain, lameness, and ultimately it will cause arthritis. So it's a tough disease to manage. And because of the complexity of this joint, or the nature of this joint, we invited our friend, veterinary radiologist, Dr. Marjorie McMillan, to talk about elbow dysplasia. What is elbow dysplasia? Who gets it? And what are the treatment options? as you may or may not know, I've worked with Dr. McMillan now for probably 30 plus years. I started out working for Dr. McMillan at Angel Animal Medical Center as the supervisor for the radiology and nuclear medicine department, where I would say Dr. McMillan probably saw literally thousands of patients with elbow dysplasia. So I thought she'd be the perfect person to speak on this topic. So let me give you a little bit of background on our friend Dr. McMillan before we get started. Dr. McMillan graduated summa cum laude from The Ohio State University of Veterinary Medicine and has been practicing veterinary medicine for 49 years. That's really impressive. Dr. McMillan is a board-certified radiologist with internships at Angel Animal Medical Center, Tufts Veterinary School, and the University of California, Davis. She was the head of the radiology department at Angel Animal Medical Center from 1982 to 1992. And Dr. McMillan was also in the first graduating class at the University of Tennessee in canine rehab, making her also one of the first of 36 people in the country to earn that title as certified canine rehabilitation practitioner. Dr. McMillan is the owner of the Sterling Impression Animal Rehab Center in Walpole, Massachusetts, which is one of the first veterinary rehabilitation centers in New England. And a little personal note on the side, Dr. McMillan is a Labrador enthusiast, and her dog Kyle is Mac's very best friend. So please welcome Dr. McMillan to the show.
Welcome, Dr. McMillan. Glad to have you back.
Good morning, Kathy and Chris, and I'm pleased to be back on PetAbility.
Thank you. So why don't we just jump right in, Dr. McMillan, and maybe you could, talk about what elbow dysplasia is in dogs and explain to the dog owners out there, maybe in layman's terms, what is elbow dysplasia?
So elbow dysplasia encompasses several problems with the elbow. So it's not just one orthopedic disease. So the most common is the fragmented medial coronoid process, which is a little chip of bone off the radius. And then there's the ununited anconeal process, which is a fragment of bone off the ulna. And then there's osteochondrosis of the humeral condyles. So it's several different disorders, and certain breeds are predisposed to the different types of elbow dysplasia.
So does a particular dog typically only get one of those disorders, or can they have all of them at the same time?
Usually they only get one. The ununited anconeal process is most common in German Shepherds. The fragmented medial coronoid process is the most common that you see in Labradors and Goldens, and then osteochondrosis can occur in a variety of breeds. It's the least common form that we see.
So since you mentioned certain breeds having one or the other, is there a genetic predisposition to elbow dysplasia?
There is absolutely genetic component to this. And the best treatment for elbow dysplasia is breeding it out of your line. That the good conscientious breeders over the years have predominantly gotten rid of the elbow dysplasia they've had in their lines by not using dogs that have elbow dysplasia for breeding. And the Golden people have worked very hard at this. So the incidence of elbow dysplasia in Golden retrievers has decreased dramatically. And the Labrador retriever people have also done a good job of getting it out of their lines, but we still see it because you have to have multiple generations without the genetic code for it in order to get your line to a place where you don't find any dogs with the elbow dysplasia.
Do you find hip dysplasia and elbow dysplasia going hand in hand?
They can. In the labs and the Goldens, yes. Often you see both of them together, but you don't have to, but it's a frequent occurrence.
So how would an owner know that their pet may have elbow dysplasia? What signs would they typically see? What's common? And when does this usually present? I mean, is it when they're a puppy or, skeletally mature?
Some dogs show lameness at a young age, 6, 7, 8 months. Others may not show lameness until a couple of years. And often the most common sign of elbow dysplasia is the dog is limping. However, some dogs have elbow dysplasia and never show any clinical signs. And so they may not be symptomatic. And the only way you can know is by taking radiographs.
So radiographs is the diagnostic criteria for diagnosing elbow dysplasia.
Yes, but I think there are, in my mind, certainly questions with radiographic diagnosis of elbow dysplasia. The criteria for the Orthopedic Foundation for Animals, which is the registry for dogs with hip dysplasia, elbow dysplasia, normal hips, is a single flexed lateral view of the elbow. And I think making a diagnosis of elbow dysplasia on a single flexed lateral view can sometimes be very flawed, and that I see dogs that have changes that the Orthopedic Foundation for Animal would ascribe to elbow dysplasia, and I don't think they have elbow dysplasia. I think they have something else causing those elbow changes, and additional imaging, I think, in some of these dogs is needed. And I think the criteria for diagnosing elbow dysplasia off a single flexed lateral view needs to be changed.
Why the flexed elbow?
Because it lets you see the areas where the bony arthritic changes are occurring better. And it also allows you sometimes to get a better look at the fragmented medial coronoid process.
Dr. McMillan, when you say additional imaging, are you talking additional x-rays and views, or would it be something else like a CT scan or an MRI or something like that?
I think that CT is probably the best way in some of these dogs to diagnose it, although sometimes additional radiographic views, like oblique views of the elbow, will give you more information. But I think the OFA has just, this has been their criteria for decades. And even though people question it and challenge it, and some of these dogs that have the changes in the elbow that are ascribed to elbow dysplasia never have a day of lameness, never develop osteoarthritis, never have an uncomfortable elbow. And so I question whether these dogs actually have elbow dysplasia.
So the importance of an accurate diagnosis is so that the pet and their elbows can be managed properly, because I would assume, as with everything, it starts with an accurate diagnosis to know what's going to be best long-term for that pet.
Yes, that's correct. But also this registry is for breeders. So if they know their dog has elbow dysplasia, the dog is not showing any symptoms, they come in to have the dog screened, they find out the dog has elbow dysplasia, then they can choose not to use that dog for breeding.
And you're saying maybe they don't have it at all.
That's right. Sometimes I will write letters for people saying, I think the changes in the elbow of this dog are not due to elbow dysplasia.
It's like a false positive.
That's right.
Can we switch gears and start talking about what treatment options are available for dogs that are diagnosed with elbow dysplasia?
The elbow is, as you said, a complex joint. It's a hinge joint, and it's a very tight joint. So it's unforgiving when there's pathology in that joint. And so when there's a little fragment of bone in there, it's like walking around with a stone in your shoe. It's very uncomfortable. And so that removing that fragmented medial coronoid process makes the dog more comfortable most of the time. Sometimes it doesn't, because there's a lot of arthritic change. But getting rid of that fragmented bone, and that can be done through arthroscopy. Also, another way of diagnosing elbow dysplasia is arthroscopy. You can actually go in and look at the joint and see if there are any changes consistent with elbow dysplasia. So getting rid of the fragmented coronoid process, and then treating the secondary inflammation and osteoarthritis. And so certainly we now have lots of choices for non-steroidal anti-inflammatories. There are several good ones on the market. The side effects are minimal, like vomiting and diarrhea, and they help to control the discomfort. But as always, in any joint, you not only need to address the inflammation, but you need to address the biomechanics of the joint. And that's where physical therapy comes in. and doing physical therapy on these joints and keeping those joints having a good range of motion, keeping those ligaments and tendons and muscles around the joint flexible and them not getting tight and spastic. So there should be a multimodal approach to treating these dogs that have elbow dysplasia. So there's the nonsteroidals, there's the physical therapy, there's laser because of its anti-inflammatory properties. There's now shockwave, which seems to have good results in some of these dogs that don't respond to other modalities. And then the other injectable things like platelet-rich plasma and stem cells.
Chris and I will often, I was thinking all those things, Dr. McMillan, as you were talking, the things that I might, pull out of my, modality bag, and shockwave certainly, laser certainly, and in between treatments, Chris and I will often use the Medcovet Luma because it just helps to get these dogs to their next appointment with that inflammation. So it seems to add benefit to long-term outcomes for us. And so I'm getting all excited about the therapy. But also, it makes me think of underwater treadmill and things like that. There are just so many things that we can employ here as therapists to help these dogs maintain their condition or maybe even, improve from their condition.
I also forgot to mention acupuncture for helping to manage pain. That often works well. And injections of polysulfated glycomines, Adequan, and things like that. So there are lots of potential treatments for these elbows that we didn't have years ago.
It seems like I'm seeing on the web a lot of these joint injections that are providing like some cushioning, and I don't know if there's a potential for healing to address these changes. I guess I wanted to ask too, like you mentioned surgery. If it's a mild case, is surgery still indicated because you have to get rid of that offending piece of bone? Does it always start with surgery, or can this be managed strictly conservatively?
Usually you need to get that piece of bone out of there because it's a chronic irritant. And
Right.
so that helps a lot because I think that really goes to alleviating the pain and discomfort. Now, in some of these severe elbow dysplasias, there are some people that are working on elbow joint replacements and have been for many years, but they really haven't taken off, and the elbow is a difficult joint to replace.
I had a personal experience with that. So here in Boston, at your former employer, Angel Animal Medical Center, Dr. Trout brought in one of the inventors, if you will, of the elbow joint replacement. Is that called a prosthetic in that case?
Yep.
And so I think he was from Washington State, and it was a dog, Mosley, a chocolate lab, who I'd been treating at Flow Dog, and he had an elbow joint replacement, and he did remarkably well. You could tell he was just so much more comfortable. Yes. And so forth. Yeah. So that was exciting for me, as a clinician, but even more exciting for Mosley and his owner, I'm sure. So kind of going back to the importance of an accurate diagnosis and as soon as possible is what I'm hearing, because the sooner you can get that offending, quote, pebble out of your shoe, there's less likelihood for these arthritic changes and so forth. Correct?
Yes. You'll still get some arthritic changes, but they progress less slowly and are not as severe.
So that's what we're trying to mitigate. And I know in the human world, the elbow joint is the worst joint to try to restore range of motion. Is that true in dogs?
I think that's true in dogs. From my experience, I think elbow dysplasia dogs are the hardest to treat and the worst joint to treat.
Interesting.
I would agree with that. I would absolutely agree with that. And then if you think about even the dog just standing and weight bearing, they have to put 60% of their body weight on the front of their limbs and 40% on the back. So it just involves everything they do from the moment they get up and walk and move and run and stand.
Right.
I think it's a difficult management. And I wonder how much importance should be placed on proper nutrition and weight management and managing these elbow dysplasia cases. Can you speak about that, Dr. McMillan?
Yeah, I think certainly there's some thought that in these dogs, young dogs, if we push their growth with some of these diets, we exacerbate the level of hip dysplasia and joint dysplasia that they will get. And so fortunately now dog food formulas are better for these growing dogs, but some of these breeders really want to push these dogs in their growth, and they can make the condition worse. There are also diets after they develop joint disease, like joint mobility diets, JM and things like that, that seem to help. And certainly these dogs should be kept on the underweight side and definitely should not be overweight.
As with everything, weight is so important, and this is a major weight bearing joint for the dog. So yeah, like Kathy mentioned, in a normal dog, 60% of their weight is on their front. So more than on their back. So you'd think, 30% on each elbow, and the faster they grow, the larger they get. And if they're overweight or obese, that just exponentiates the problems.
And I think about, just made me think off the top of my head too, the importance of Chris and I always talk about this, but the importance of traction in your home for dogs with elbow dysplasia, making sure they don't slip and splay or fall, things that you can do in their environment to help them through their daily activities, and even having a really good orthopedic bed for them. Because if you think about them laying down and putting the pressure on their elbows, and some of these dogs are getting hygromas from laying on hard surfaces. And so I imagine it must be uncomfortable for them to get into a position sometimes with this condition, even laying down. So I think, modifying their environment, as Chris and I always talk about, is really going to be one of the key factors in managing this condition.
Yes, and certainly dogs that have lots of stairs to climb, that can be a problem for them with any of these joint problems. So the elbow dysplasia can be more uncomfortable for them to climb the stairs.
And the impact going down.
Right?
Yeah, absolutely.
Yeah, I want to speak a little bit about that, because I think that, jumping should be eliminated if possible. Again, especially jumping down, because the front limbs are the dog's stoppers, if you will. They slow down motion, and there's just a lot of impact. And so all that body weight, again, it is definitely exponential. What the percent body weight, or how many times their body weight when they're going down. I know, like with running or trotting, it's like up to 3 times their body weight is put on a single front limb.
Yeah, I don't know the exact number off the top of my head, but I would even consider maybe 50% more weight on those front legs when they're going downstairs.
Yeah, and so I always coach my pet owners to, if their dog insists on jumping off of something, to put extra padding like under the rug, just to mitigate that impact, and at the bottom of the stairs, and having those stair treads on the stairs themselves, if it can't be avoided.
You should, if your dog has elbow dysplasia, you really should maybe even go back and listen to the show that we did on ramps versus stairs, because it was great. And we talked about the benefits of both, pros and cons of both. But dogs with elbow dysplasia, getting in and out of the car, also another, getting out, repetitive, concussive, down, down, down. And those giant breed dogs, my goodness. So maybe, take a listen to ramps versus stairs, and that might be a good help, good way to help your dog safely get in and out of the car or on and off furniture.
Yes. And,
Yes.
as long as you're mentioning past shows, we kind of glossed over in some of the treatment. You mentioned the MedcoVet Luma, but that is a type of light therapy device. And we have 2 shows on laser, and MedcoVet is our sponsor, but it's because Kathy and I believe in the product, and we've gotten good results. We also interviewed Dr. Jennifer Vitucci of Pulse Vet Shockwave Therapy. And so if you are interested in learning more about these potential treatments for your pet, please listen to those shows. It will help to provide some questions that you may want to ask your vet or rehabilitationist.
I've tried it on myself recently with the newer, Dr. McMillan's practice has the Shockwave, and with the newer models, so much better, so much more comfortable. Animals are tolerating it really well, and they're getting good results.
If a dog presents with arthritis of the elbow, can we presume that they have some degree of dysplasia, or can degenerative joint disease occur without a dysplastic component?
Yes, degenerative joint disease can occur without elbow dysplasia. Also, if they've had any trauma to that joint, you can get osteoarthritic changes. So all dogs with elbow arthritis don't necessarily have elbow dysplasia. Many of them do, but a lot of them don't.
Good to know. And I think, Kathy, as rehabilitationists, oftentimes we're treating that inflammation, the arthritic changes, as well as the compensations. So, to your point earlier, rehab is just so important. And I was wondering if we could discuss, the recovery process so pet owners know, let's say they've had surgery, how long do they typically restore their quality of life? Is it instant or does it take a while? You mentioned that it's a very difficult joint to rehab.
So it's not immediate. It takes several weeks for the inflammation from the surgery itself to calm down. And it can take a few months sometimes for the dog to begin using that joint normally. And this is where, post-op rehabilitation is important. And I think one of the other things that's important with dogs with elbow dysplasia is people don't just let them lie around, that they get them up and walking every day. Now, they don't have to be long walks, but they need to use those joints. I think one of the things that sometimes happens with these dogs is they have the surgery and then an NSAID and pain meds are thrown at them, and then nobody talks to them about physical therapy. And therapy is so important in the recovery of these dogs and getting them back to using the joint normally. And so some dogs, it's quicker than others. It depends on how invasive the surgery was, the experience of the person doing the surgery, and how much arthritic change is there. So it can vary from a few weeks to a couple of months, but many of them do considerably better after the surgery. But they need the rehab. Really important.
And I would think guided rehab in terms of timelines, because too much rest, to your point, is not good. They need to weight bear, they need to move that joint, etc. But also sometimes if they do feel great and they're on drugs, they could do too much too quickly. I know a lot of the surgeons that I've worked with that have performed surgery for elbow dysplasia have been somewhat cautious in terms of how quickly the dog do certain things. And, I make sure that I am very strict in terms of following those protocols.
Yes, you don't want to overdo it. Some people want to go from 0 to 60, and then they cause setbacks, and it takes the dog longer to recover.
Can you talk about some of your favorite supplements that you like to use for dogs with elbow dysplasia? Are you pro Dosequin, pro Glycoflex? What are your go-tos?
One of my first and favorite go-tos, fish oil, because we know that fish oils, they've been shown in studies that they're anti-inflammatory. And I'm very particular about the fish oil that I use. I use the Nordic Natural because I think they're a really great fish oil. They don't have a really fishy smell when the dog takes it. And I think that they have good anti-inflammatory properties. So I think that is one of the first things I would recommend, and to all these dogs that have joint problems. And most dogs tolerate it and don't have any bad reactions from it. I do think some type of glucosamine chondroitin supplement is important. Although, again, that's controversial and people argue about it, particularly in humans, that they really don't do a whole lot. But in animals, they seem to have good results. And so there are many of them on the market. I think Dosequin is a good one. There's Vetriflex, there's Arthro-Ease. So there are a bunch of them out there that are available online. And then sometimes I'll use some herbal supplements, particularly in these dogs if they've got a lot of muscle contraction and muscle pain and compensatory changes in the muscles. I use a herbal product called Myocalm Plus, which has valerian and hops and passion flower and calcium magnesium, which helps to relax some of these muscles and give them more comfort.
Well, back to the Nordic Naturals, is that also for humans? Because I seem to recognize that name.
Yep, I take some every day.
Yeah, I take fish oil every day as well. And how is it administered? Because I know my fish oil is in a capsule. So how do people get that in their pets?
So the Nordic Natural Omega Pet comes in a liquid, and it comes in capsules. And I often prescribe the liquid because you just mix it in with the food. Most dogs like the fishy taste, and it's easy to get into them.
And they don't get a tremendously like fishy breath. I just want to say that.
They
I
don't.
feel like with the Nordic Natural, yeah, you don't really get a lot of like gross fishy burps.
Yep, exactly.
But I do love it. I do love it. And Nordic Naturals is so passionate about their products. So yeah, I would recommend checking them out.
And it also helps their skin and their heart. So
Right, right. Yeah.
Great.
How about the use of Adequan? I don't see that many patients on getting Adequan injections, and I feel like my own personal feeling is sometimes I see patients, I'm like, this really works well. And sometimes I see patients and I'm like, this didn't really change anything.
right.
So can you discuss maybe what Adequan is, how it's administered, and what its effect might be or would be?
So it's a polysulfated glycosamine glycan, which helps to rebuild cartilage. And I agree with you. In some animals, it's like a miracle drug. You give them 2 shots and they're dramatically better. So I sort of save the Adequan for dogs that haven't responded to the routine types of treatment that I use. They have significant arthritis, and it's like, okay, let's go to the Adequan and see what results we get. And sometimes I'm really surprised at how significantly better they do. So yeah, I think it has its role. It's not one that I jump to as my first choice because I use some of these other modalities like laser and shockwave and the non-steroidals.
And I know some veterinary practices are teaching pet owners how to do those injections, and it certainly makes it much easier in terms of logistics and costs and so forth. So that's been a nice change that I've seen over the years. So what is the potential, I guess, long-term sequelae of having elbow dysplasia? And, what would you recommend for these pet owners in terms of ultimately gaining the most in terms of quality of life?
Some dogs, as I said, develop no significant arthritis. And those are the ones that I question, do they really have elbow dysplasia? To the ones that develop such severe debilitating osteoarthritis that you're looking at an elbow replacement. There's a lot of animals that are in the middle of the road that you can manage their arthritis with medications, modalities like the laser and exercise that can do well for their entire life. Fortunately, many new medications have come on the scene as a result of research in people. And there's always research being done on arthritis because it's such a debilitating disease in people. So more and more treatments and medications keep coming down the line that we benefit from in veterinary medicine. And I think that in my experience, the majority of dogs with elbow dysplasia can live long, healthy lives where they're not disabled if you provide them with the joint support, the cartilage support, physical therapy. We do have lots of dogs that come in for maintenance physical therapy because it keeps them mobile and moving and pain-free. So most of the dogs that don't have the severe arthritic changes can do quite well until they leave the planet.
And when you say quite well, would you say can resume all normal activities? Going out in the woods, going swimming, playing with their toys, interacting with other dogs, etc.?
I think that is also an age factor in that many of these dogs up until middle age do fine. As they age and get arthritis in other joints, then you have to modify their activity a little bit. They may not be able to go out in the woods and jump over logs and things like that, but they can still play ball and go for reasonable walks and play with their doggy friends. If they're really geriatric, then sometimes you have to cut back on some of that activity.
I think it's
this rehab person is going to really come in to play here, so we can teach you what's the best activity for your dog, what are the movements that we want to avoid, what's the activity level that they can do, and so we can direct and we can guide owners in that aspect of their dog's life as they age, or with a condition like elbow dysplasia.
I absolutely agree, Kathy. And one of the things that really bothers me, Dr. McMillan mentioned that, how debilitating arthritis can be, but I've had several pet owners over the years say, oh, they just have some arthritis. It's no big deal. It's just arthritis. Again, if you make that parallel to humans, myself included, I mean, I wake up in the night now because my knees are so achy and I'm on a lot of supplements and I try to do healthy exercise and all of that. It is very uncomfortable. And so, think about all the people out there that have gotten total knee replacements, total hip replacements, because it becomes debilitating. So it's not just arthritis. It is a major quality of life issue potentially for your pet.
We need a bigger word than arthritis so that people can understand how painful it is. Like I have arthritis in my foot, and it was so debilitating that I chose to have surgery to remove some of the bone fragments there, because it was so painful. It would wake me up in the middle of the night with sharp stabbing pain. So I think we can't dismiss that. It really can be very uncomfortable to really debilitating. And if somebody could get on curing osteoarthritis, that would be wonderful.
Yeah. And you said like a bigger word, but I think that part of the problem is it's so common that it's part of our everyday vernacular. And so when something becomes, spoken of so commonly, then we as humans tend to be more dismissive because it's like, well, everybody's going to get arthritis, no big deal, but that absolutely is not the case. Dr. McMillan, as a veterinarian, I'm sure that you definitely want to see all dogs on a regular basis, especially as they're aging, to address some of these issues that occur, not only arthritis, but other potential conditions. Can you just tell our audience how important it is to get regular veterinary checkups for your pet?
So with geriatric animals, not only because of their arthritis, it's just a good idea to have them checked out a couple of times a year with senior blood work, and have them gone over to check out their joints and their muscle mass and muscle strength and fragility and all of that. I think that when people think of arthritis, they just think of bone. And there's a lot more that goes on with arthritis than just the bones. It's the soft tissue around the joints, and then the changes that occur in the soft tissue from walking abnormally and bearing weight abnormally and not moving your joints through their normal range of motion. So many of these senior dogs will come in and they're walking like they're stilted, with a stilted gait. They have lost range of motion in their hips and their knees and their elbows, just because they've been walking abnormally for so long, and people go, oh, they're just getting old. Well, that's not true. Some of these dogs, when they come in for their annual, if we address those and get them into some massage and range of motion and stretching, in 3 or 4 weeks, they're doing things they haven't done in years. And so just saying, oh, they're getting old, you really need to have them come in, have the veterinarian check them out, and see what things are contributing to this dog's slowing down rather than just aging.
Dr. McMillan, as we're getting close to wrapping up here, I was wondering if we could go back to some of the things that you like to use as far as your supplements and medications and other modalities. And one of the things that is on our radar these days is CBD and the use of CBD oil. I wonder if you can give us your thoughts on using CBD oil with some of our patients that have joint abnormalities, elbow dysplasia, hip dysplasia.
So a lot of people are using CBD for their animals and for themselves. And I think the jury's still out on how well it works. But if you're going to use CBD in your pet, you need to use one that has research behind it, and you know that what they say is on the bag is what actually is in the product that you're giving to your animals. The one I like is Ellevet, E-L-L-E-V-E-T. I think they've done research on it. That's the one that if people use it, seem to get good results. It also helps with some anxiety in these dogs. There's some evidence that it helps with sleep seizures. And so more information will be coming along. But the important thing is to get one that has the research behind it and has the accurate dose for your pet.
And we also did a podcast interviewing somebody on CBD. And so it was very informative to me. He's a national lecturer and so forth, just to further expound on some of the things that Dr. McMillan stated there.
That was Dr.
Josh Sosnow.
Josh Sosnow, and he was from, I believe, Companion CBD. So he was really nice to spend a good hour with us talking about the use of CBD. So, Dr. McMillan, as we're wrapping up, is there anything you would like to leave our audience with, a pearl of wisdom, if you will, about elbow dysplasia?
Just in general, I think one of the best specialties that has come down the road in veterinary practice is physical therapy. Because,
Here.
Yes,
Yes.
because many of these dogs still, because people are ignorant of physical therapy in animals and what it does, put these dogs on an NSAID and don't address the biomechanics of the joints. And so these dogs aren't getting the full benefit of using that NSAID along with therapy treatment that will make a significant difference. And so whether it's elbow dysplasia or hip dysplasia or spine disease or any of those things, that physical therapy, which usually does not cause pain and discomfort, is non-invasive, is one of the best specialties that I've seen develop in my practice lifetime.
Well, we would agree.
Well, I was going to say,
Yeah.
we didn't even pay you to say that, Dr. McMillan.
I know.
I love that as your final word.
I will tell you that, way back in the day when the specialty came out, Dr. McMillan and I were always sort of on board with some type of sports medicine, rehabilitation, things that we could do to improve these animals' quality of life or improve their outcomes from surgery. And there were just so many cases we saw at Angel that it was tough to see. These dogs had, conditions, and maybe they had surgery and they never really fully recovered from surgery. And that was it. So to have physical rehabilitation available for pets is a blessing, really. So I'm excited to be a part of it for sure.
Right. Recovery faster and farther.
Yeah,
Yeah.
right.
Surgery gives you anatomical recovery. Physical therapy gives you functional recovery.
All about the function.
It's
Right.
all about function.
Right.
Mhm.
So, Dr. McMillan, can you let our audience know where they can find you? So let's say they want to do their OFA hips or elbows, or if they're interested in shockwave therapy, where can they find you?
My practice is the Wind Hover Veterinary Center, which is in Walpole, Mass. And my rehab center, Sterling Impression, is just down the road from that. So that's where you can find me most days, and hopefully for many more years.
I hope so. So that's Windhover, WINDHOVER, Windhover Veterinary Center.
Yes, as in the Sparrowhawk, which is the Wind Hover, and the poem The Wind Hover by Gerard Manley Hopkins.
And you may have heard throughout this podcast a few birds in the background. And Dr. McMillan is also wears many hats, and she's also an avian expert. And we did a show with her not that long ago about birds. So if you're interested in birds, please check that out. But if you hear the birds in the background, those are Dr. McMillan's little canary.
Exactly. I'm glad you mentioned that, Kathy, because I was going to say it is not your sound quality. Those are Dr. McMillan's birds. And, at the beginning of the show, I don't know if people caught when I said welcome back, because yes, we had a lovely interview with Dr. McMillan a few years ago when we were just getting started with our podcast. And I learned so much about birds, because that is not my area, if you will, but I think they're fascinating.
They are fascinating, and birds don't get elbow dysplasia. They do get arthritis, particularly in their feet, and cats do yoga every day naturally.
Yeah, there you go. And I just wanted to emphasize for my last word that I think, this topic was elbow dysplasia, but it kind of led into arthritis and, just emphasizing again that we have so many tools in terms of that multimodal management. And so I just think this is going to be a great listen for our audience. And I can't thank you enough for being here again today, Dr. McMillan.
Thank
Well,
you.
you are welcome, and I'm glad to do it.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at PetAbility Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you, and tune in next time.